Good afternoon. Diabetes, a word which has been affecting us every day. We listen to it, but we don't know what it actually is. Hi everyone, I am Dr. Tribhuvan Gulati, Senior Consultant, Internal Medicine and Diabetes with apollospectra Hospital, Karol Bagh. Today we will be talking about diabetes. As we all know that diabetes is something which is increasing rampantly in the world, and India, which is placed at the second level in the world of having the maximum diabetes patients, very closely behind China. And it is expected that the number of diabetes patients are going to increase and cross the Chinese population of diabetes by in the next 2 to 3 years by 2025. But that number seems to be approaching faster, and we expect it to come about in the next 1 to 1.5 years. So looking at what is diabetes, what are the symptoms and signs of diabetes, what is the necessity of treating diabetes, and is diabetes reversible or can it be sent into remission? So looking at that, what is diabetes? If we look at the very layman terms or in a general language, it is a chronic progressive disease or a condition that affects the way that the body processes the blood sugars or glucose. Everything and anything that we eat ultimately gets into the stomach and gets broken down to either glucose or amino acids or fatty acids, and there are hormones that play with these micro and macronutrients and ultimately help in controlling blood sugars. Now, what happens in type 2 diabetes? Type 2 diabetes is a condition in which either the person has very high insulin levels and insulin resistance, ultimately making the beta cells of the pancreas to secrete more insulin, which over a period of time go into dormancy and ultimately reducing the insulin levels in our body. And the second condition is, like I said, reduction or absolute depletion of beta cells, leading to absolute absence of insulin in the body. So when body does not have insulin, or the body is making insulin but the utilization of the insulin is not there, these are the two conditions which ultimately lead to type 2 diabetes. Type 1 diabetes, about 10% of total number of diabetes patients is type 1. It is a genetic condition in which the patients or the child does not make any insulin from the very birth or very early age, ranging from 3 years of age to about 15 years of age. But we have had history in the world that a 95-year-old man was also diagnosed with type 1 diabetes. Now, coming to the symptoms of what are the symptoms of diabetes, there is increase in thirst, which we call polydipsia. There is increase in hunger, which is called polyphagia, and there is an increase in urination, that is called polyuria. Then there is increase in nighttime urination, which is called nocturia. There is increase in hunger, despite of that loss of loss of weight, easy fatigability, sleepiness or increased sleepiness, especially after taking a meal, and blurring of vision, or there is difficulty in visual acuity. In some patients, actually in many patients, the patient might just present with an erectile dysfunction problem as a presenting symptom of diabetes, and almost 90% of patients who have erectile dysfunction, they have some level of glucose homeostasis is disturbed, meaning glucose metabolism is disturbed, which is causing fluctuations in their blood sugars. Now, why is it important to treat diabetes? Diabetes is a disease which can actually affect anything and everything that comes between the root of our head hair to the toenail. So all the organs that come in between, diabetes can affect and actually cause damage to those organs. So these can actually, the patients very commonly, eye infections or blurring of vision, cataract, retina changes. Retina is basically the curtain where the image is formed. So there are new vessels that are formed, or clots or bleeding that can occur. Ear, nose, oral or throat infections, very commonly fungal infections. I'm sure everybody and most of us have heard about black fungus that occurred during COVID, especially in diabetes patients. Kidney, liver and heart problems are the most common problems that we hear in diabetic patients. And nerve issues. Patients complained a lot about numbness of feet, tingling sensation, vibration feeling, muscular aches and pains and muscle weakness. So how do we treat diabetes? the basic foremost step of treating diabetes is lifestyle modification. And what does lifestyle modification mean? It is the diet and the exercise. So if you can control your lifestyle, if you can control your diet and are on a proper exercise regime, you can actually prevent from getting into diabetes and to an extent control your diabetes by about 60 to 70%. Now, why is it important from a geographical point of view is that every third patient that is there in India is a diabetic patient. Every second patient is a pre-diabetic patient or an undiagnosed diabetes patient, and every 10th person in the world is an Indian who has diabetes. So you can see the incidence and prevalence of diabetes that is there in the world, and this is a disorder that affects all the organs, like I previously said, and it affects ultimately all the organs and increases the cost of resources and reduces the quality of life and life expectancy of any individual who has uncontrolled diabetes. And to top it all, it is a condition which can be prevented by just improving the lifestyle, your diet and your exercise, and it can actually be detected much before the occurrence of frank diabetes. So you can, pre-diabetes is a condition which is a short form for predisposed to diabetes, where the patient has impaired fasting glucose, where the fasting is slightly higher, or impaired glucose tolerance where the postprandial glucose is a little on the higher side. So if we do some lifestyle modifications, give some insulin sensitive medications for a short period of time, the patient can actually go back to being normal without landing into frank diabetes. And now recently the American Diabetic Association has given a statement that diabetes can actually go into remission if we are able to control the diet and exercise and are able to maintain that for a longer period of time. Now, what are the risk factors for diabetes to occur? Now, the risk factors can be divided into two categories. One is the modifiable risk factors, one is the non-modifiable. Non-modifiable risk factors meaning the factors that cannot be changed, that you are born with. So it is ethnicity, like the Indian ethnicity have a tendency to be diagnosed with diabetes 10 years much before than the Caucasian or the Western counterparts. So we have to be more careful. Reason being, Indian and the Indian subcontinent have a tendency of central obesity. You must have heard of something called fatty liver, which we in medical term called non-alcoholic fatty liver disease, which is also a predisposing factor for diabetes. Even PCOS is actually not a gynecological issue, it is actually a hormonal issue which is a predisposing condition to diabetes. So genetics, ethnicity and race, these are the non-modifiable risk factors for diabetes. And the modifiable risk factors for diabetes, the first one is obesity, yani motapa, second is inactivity, and the third one is the diet. So if we are able to control the modifiable risk factors, we will be able to stop from triggering of the genetics or the genes that are predisposing you to diabetes. Like my favorite statement or favorite line at this time is, your genes are like a loaded gun. It's the lifestyle that triggers it. So you can carry a loaded gun around and nobody will be hurt, neither you will be hurt. But the moment you trigger the gun, that is when the problem starts. So if you are triggering your genes by your lifestyle, not having a good lifestyle, the chances of genetic triggering happens and you are predisposed to diabetes. Now coming to something which is a very hot topic nowadays is diabetes remission or diabetes reversal. To understand between the two, these two are two different things. So diabetes remission actually means the patient has normal blood sugar values and is down to a HbA1c of normal individual of below 5.6 only on metformin and lifestyle modification, and can maintain that level for a good long period of time, especially at least for the 12 months. And if he is able to maintain it for 12 months, we say the patient has gone into diabetes remission. Now diabetes reversal is a condition where the patient is maintaining normal blood sugar levels, normal HbA1c without intervention of any medications, only on lifestyle, only on diet and only on exercise. So coming to the point back again to diabetes, 14th November being the World Diabetes Day, I would request you and I would request all my listeners that diabetes is a preventable chronic progressive disease. I have added the word preventable because it is in your hands. It need not occur in your family or in your friends or in your counterparts. That it's not necessary that you have to have diabetes if your family history of diabetes is very strongly positive. If you maintain a good diet, good exercise, good lifestyle, are physically active, I'm very sure that if your diabetes in the family is running and it occurs at the age of around 45 to 50, I'm sure you can push it back to 60. And at this level of, at the age of 60, if there are some changes in your sugar levels, then definitely a small dose of some medications can bring down the sugar levels to normal. Thank you very much.